Hi all, back with medical surgical nursing genitourinary system, urinary incontinence. See, from the first, I am telling, repeatedly saying in the clinical manifestation, urinary incontinence will be there, urinary frequencies will be there, right? Now you will be thinking, actually, what is urinary incontinence? Urinary incontinence means involuntarily the urine leakage. Okay, involuntary urine leakage. Okay, so that is urinary incontinence. It might be due to the urinary bladder sphincter get lost as control. Okay, because of that the urine will be leaking out. Okay, now what will be the etiology and risk factors? Pregnancy can be a cause, age can be a cause, cystitis. Okay, then hysterectomy. See, whenever there is a removal of that organ, we say it as ectomy, tubectomy, hysterectomy, removal of the uterus. Okay, then due to any some medication like overuse of antihypertensive drugs, okay, then lifestyle modification like eating fast food and all, okay, then renal calculi, that is kidney stone, which we will be discussing detailedly in for the coming classes. Okay, congenital also might occur. Congenital means at birth. Okay, obesity, alcohol dependency. Okay, so this all are the etiology, and we will moving on to the clinical manifestation as per the types. Okay, types as per the clinical manifestation, together we will be dealing on. The first type is stress incontinence. Stress incontinence means it is unintentional, not intentional, unintentional release of urine. Okay, it is most seen in females actually. Okay, what happens is like coughing. When they cough, when they sneeze, when they laugh, or when they lift something, urine will be passed. Okay, that is known as stress incontinence or unintentional release of urine. The second one is urge incontinence. Urge, okay, urgency. It can also be known as reflex incontinence. Now what happens is like sudden involuntary contraction of the muscle. Sudden involuntary contraction of the muscle, okay, of the bladder muscle get contracted in suddenly, like if they are changing the position of their standing when they sit, or when they sit when they stand, urine is passing, or due to sexual intercourse. Okay, when they hear the sound of the running water, they pass urine. Suddenly the bladder get contracted and the urine get passed. Okay, that is known as urge incontinence. The third one is overflow incontinence. Overflow incontinence usually seen in men due to prostate enlargement. Okay, it might be due to any damage or blocked in the bladder. Okay, then functional, like dribbling of urine. Dribbling of urine is like, see, once your tap is open, okay, close it. If you're not closing it tight, it small, like drops of water will be falling, like one drop, two drop, three drop, right? Drops will be there. The same way urine will be dribbling. Okay, dribbling of urine, then from constantly from the urethra is known as overflow incontinence. Okay, then functional incontinence means if there is any physical impairment or mental impairment, like is there any surgery has been done, or because of the old age. Okay, sometimes functional incontinence or leakage might occur. Okay, next one is mixed incontinence. Mixed incontinence means urge and overflow together occur in a person is known as mixed incontinence. Both urge and overflow at the same time occur in a person is known as mixed incontinence. So that was the types of incontinence, urinary incontinence. Now moving on to the diagnostic evaluation, history collection, physical examination will be done. Okay, urine analysis, urine culture, PVR we had discussed, post vital residual. That it is to measure the balance of urine left in the bladder after voiding. Okay, after voiding means after urinating. Okay, then blood test, blood urine nitrogen. Okay, so this was all about diagnostic evaluation. Next one is management. In management, pharmacological management will be giving antidepressant for the patient. Okay, then estrogen anticholinergic for the patient, catheterization will be given, and also we will advise if it is a functional incontinence, we will advise for napkins or pads, okay, for the old age people, so that dribbling and all will not occur usually. Fine. And other management is like we will advise the patient to do Kegel exercise. Kegel exercise is like to hold the urination, to hold the muscle or tighten the muscle. Okay, you relax and tighten the muscle to control the urine flow. Okay, that is known as Kegel exercise. Kegel, Kegel exercise. Okay, this exercise presents or prevent or control urinary incontinence. Okay, it takes around 12 weeks to notice a change. Fine. So that was all about Kegel exercise. I said Kegel exercise detailedly because it is asked for 2 marks, that's why. Okay, then we are moving on to the surgical management. Surgical management is like a sling procedure. Sling, S-L-I-N-G, sling procedure. A mesh will be inserted, okay, in the neck of the bladder, and we will be supporting the urethra, because urethra is lost the control, that's why urine is flowing. So we will support the urethra to stop the leakage. Okay, and artificial spinger, that is also a surgical procedure. A valve is inserted to control the flow of urine from the bladder to the urethra. Same, a U-shaped or a V-shaped valve will be inserted to support the both bladder as well as urethra to prevent the leakage. Okay, this was all about urinary incontinence. I hope you understood. Once again, urinary incontinence is the involuntary leakage of the urine from the bladder, from the urethra. Okay, it might be due to the blockage or what to say, loss of control in the bladder or urinary sphincter. Etiology: pregnancy, age, okay, then obesity, alcohol dependence, okay, then hysterectomy, cystitis, UTI, lifestyle modification, prolonged medications of antihypertensive drugs or some muscle relaxants. Okay, types as well as clinical manifestation. First one is stress incontinence by coughing, sneezing, lifting and all. Urge incontinence, okay, sudden involuntary muscle contraction, okay, while changing the position or in sexual intercourse. Overflow incontinence, okay, usually in men due to prostate enlargement, okay, because of the bladder damage, dribbling of the urine from the urethra. Functional incontinence due to any impairment in the physical or mental impairment. Mixed incontinence, both urge and overflow at the same time in a patient, is known as mixed incontinence. Okay, diagnostic evaluation: physical examination, history collection, urine test, blood test, okay, PVR, okay. Then management, medical management, pharmacological management, antidepressant, topical estrogen, and cholinergic symptomatic treatments will be given for the patient, and Kegel exercises will be given. Advice to the patient to do Kegel exercise. Kegel exercise is to prevent the urinary incontinence by controlling the urine muscle, other holding the bladder muscles and all. Okay, by tightening it and controlling the urine flow to prevent the leakage. Surgical management: sling procedure and artificial sphincter can be inserted to prevent the leakage, both supporting the bladder and the urethra. I hope you all understood. If there is any doubt, please get back to me. Okay, thank you. Have a nice day.